If you are someone with alopecia, seborrheic dermatitis, dandruff, scalp irritation or issues, or you have a family history of those things, or you just want to better learn how to care for your scalp as a part of your overall hair routine, then you don't want to miss today's episode of Your Hair Made Simple, where we're chatting with a licensed dermatologist to answer questions about how we can incorporate our scalp health, be mindful, and be forward and future thinking, right? So today's episode is sponsored by our Your Hair Made Simple Nourishing Hair products, our Nourishing Hair Oil, and our Nourishing Hair Butter that are formulated to be safe for those with sensitive skin and allergens. You can check those out at the link in the description box for yourhairmadesimple.com. Be sure to sign up on our newsletter so that way you can stay up to date with all things happening at Your Hair Made Simple, including our 21 Days of Simple Hair Challenge over on TikTok. And that's all, folks. So let's get you into today's episode. Subscribe and like this video and stick around to learn some more. What's up, y'all, and welcome back to another episode of Your Hair Made Simple, where we encourage you to embrace your natural hair with clarity, confidence, and courage. I'm your host, Shannon, and today we are here to talk about a very exciting topic of understanding the different conditions that can be impacting our scalps, from alopecia to seborrheic dermatitis, conditions that may or may not be common, and what we can be doing to be mindful of them, be preventative of them, and different types of treatments that may be available depending upon the condition. So I'm so excited because I have Tunisia here with me of Divine Derm ATL, a licensed and certified dermatologist, to help us really unpack this conversation. So Tunisia, thank you so much for joining us today. I'm going to turn it over to you to say hello and tell us a little bit about your hair journey.
Hi, everyone. I'm Dr. Cornelius. And, of course, you can see I'm rocking the short natural haircut, which I have had for about 2 or 3 years now. I went natural in my second year of medical school, so about 20 years ago. And in changing from a perm processed hair, I had to learn my hair because it had been many years since I had used different types of products to just kind of manage it. And it took me like almost a year to find the right products for my longer curly hair. And now I have found new products for my shorter curly hair. But I've been around the world as far as having pressed hair, permed hair, dyed hair. I've worn braids, sew-ins, and over the past few years, this is all I've been rocking because it's been easier with having 3 kids. But all of my hair care experiences have allowed me to be a little bit more empathetic with my patients when they are dealing with scalp health or hair health issues, and it's made me a better dermatologist.
No, absolutely right. Because you can empathize, you can relate. You've experienced the feeling of a perm, you've experienced like having it straightened and, when it poofs up, or like just even not just the actual like styling, but like the experiences of navigating the world with those, or thinking about your hair and how you're showing up and what may or may not be appropriate, and pushing back on that, and deciding what you want for yourself. And some of that is really the emotional work that comes with the physical attachment of our hair. I think it's amazing that you can empathize with your patients in that way.
Definitely.
So jumping into the conversation, as you talked about, like empathizing with your patients and the people that you're seeing, right? Because everybody maybe has not had an experience with the derm, or maybe doesn't even really recognize that something that they're experiencing with their scalp, maybe dryness or something, is something that is derm visit worthy. So I would love if you could talk to us a little bit about what are you seeing patients for when it comes to the scalp? What are some of the common things? I know we hear terms like alopecia, and there's different types of alopecia. We saw on the Netflix documentary, they have the Texas football cheerleaders, the way that I don't know football sports, but I'm like, wow, like the main football cheerleading girlies, the dancers. And one of them was talking about like having alopecia, and it was hereditary, right? And so she just chose to go bald. And so that's like going viral on social media right now. So, traction alopecia, she has a hereditary type of alopecia. There's so many types of things going around. What are just starting with some of the common ones that you see that we can be mindful of before kind of diving into some of the more uncommon ones?
Yeah, one of the most common scalp conditions that I see in all ages is seborrheic dermatitis or dandruff. And usually it doesn't start until puberty in children, but it's essentially there's an overgrowth of yeast that can occur on the scalp, especially when there's a lot of oil production, or you have really oily skin, and certain people are sensitive to that overgrowth. When that yeast overgrows, it actually triggers an immune response that is what gives you the itching, the flaking, and that's what kind of gives you the symptoms that your scalp is uncomfortable. So We see that in all ages, and that's probably the most common scalp condition that we see.
Hmm.
And it has a lot of overlap with psoriasis, which tends to have thicker plaques that are more like localized. So while seborrheic dermatitis or dandruff sometimes encompasses the whole scalp, psoriasis may be more patchy, but there's a lot of overlap and sometimes they can look very similar. It is important to know whether or not you have psoriasis because psoriasis actually is not just a skin disease. It can affect your joints and it also
Yeah.
can create systemic inflammation. So whenever we see scalp flaking, we always ask questions, or dermatologists will ask you questions about
Yeah.
other symptoms because we really want to rule out psoriasis. And the management can be different. Psoriasis has a lot more medications that can actually prevent the disease from coming, as opposed to just reacting with anti-inflammatory treatments. I think the biggest thing is, as Black women, sometimes we get too comfortable with our scalp being itchy and painful and tender. I
Mm.
have patients who say, yeah, my scalp has been tender, has been itchy for years, and that's just not normal. And so either, your scalp is inflamed, something's irritating your scalp, you're allergic to something,
Yeah.
or you have dandruff or you have psoriasis. But then there's other things too. Sometimes we find different autoimmune conditions of the scalp. So you really should not be aware of it. And
Mm.
and this kind of goes into like, of course, when it's time to wash your hair, your scalp kind of feels itchy. One thing that comes up a lot with my Black patients is how often I should be washing my hair, because some of us will go, 3 and 4 weeks, which I think is too long. If you have
Yeah.
a protective style or a style in which you need to extend it, you should still have some form of cleansing of the scalp,
Hmm.
because you want to keep that follicle clean and able to function so that you can have healthy hair. But in all the conditions that we consider to be inflammatory, we recommend more frequent hair washing because it kind of resolves a lot of the issues that we see.
Yeah. And that's really helpful. And so to clarify, because I've seen conversations about seborrheic dermatitis and they're like, it's not just regular dandruff. So like, is it, and this is like yeah, is it dandruff? Like any type of dandruff is considered seborrheic dermatitis? Oh, okay. So it is, it's
It's
all,
kind of on a spectrum. Like mild seborrheic dermatitis looks very different from severe seborrheic dermatitis. And severe seborrheic dermatitis looks a lot more like psoriasis, which is why I say there's that
got
overlap.
it.
So if you have mild flaking, it's just a mild form of seborrheic dermatitis.
Okay.
Hardly ever is it truly just a dry scalp, because your scalp naturally makes oils. I mean, your hair
Mhm.
can get dry because those oils sometimes don't come all the way down the shaft of the hair. Dry, flaky scalp is seborrheic dermatitis most of the time.
Okay. And that's helpful to clarify, right? Because I think, again, you can look out into the interwebs and see anything. And it's kind of like, is it dandruff? Is it not dandruff? Is this extra
Mhm.
special dandruff? Like, is my scalp doing something different?
It's
Like,
mild. Dandruff is mild seborrheic dermatitis.
got it. Okay. And thank you for that. And so, right, when we're thinking on the spectrum, on the extreme case, it can look closer to psoriasis, which is like the plaque buildup that you said. So if it's mild, then it's possibly treatable at home, or does everything requires kind of like a
Mhm.
visit? Are there things that people can be doing to be more preventative and thoughtful when it comes to that?
Yeah, if it's mild, you can do over the counter like dandruff shampoos. I mean, sometimes as simple as tea tree oil can be beneficial
Hmm.
for individuals. That's because we talked about that yeast.
Mm.
Tea tree oil has some antifungal, antimicrobial properties that can help keep it in control. So, yeah, over the counter products can definitely help. And more frequent hair washing actually helps, because if you can remove the oil and the yeast from the scalp more
Yeah.
effectively, you don't have that hypersensitivity or response
Mm.
to those things. If you can remove, the pollutants, the oil, the dirt, the sweat, all of that, your hair follicle and your scalp just function better.
I think that's so important, right? Because we know that people keep braids in for 3 months. So we know that people are like, patting the scalp down, like fighting for their lives a little bit and thinking like that's normal, right? And culturally, some of those behaviors are normal. But in terms of the actual like health habits that we should be curating for ourselves, going that long without washing your hair can be more detrimental. And if it's impacting the quality of your scalp, it's kind of shifting away from that protective mark that we maybe are hoping to see, right? If we're compromising being able to cleanse our scalp for being able to
Yeah.
like have our hair put away.
Yeah, a lot of it is preference. I mean, there are some people, you always find people who can do anything to their hair and nothing happens to it. I'm one of those people. Like I could fry it, dye it, color it, and it still grows and it grows long. But if you have a family history of hair loss, if you have
Mm.
seborrheic dermatitis, if you have inflammatory scalp diseases in your family, like you already have the predisposition to have issues with your scalp and of course
Hmm.
hair. So you kind of need to be definitely definitively more proactive on keeping the
Yeah,
scalp clean, healthy. You don't want to be chronically experiencing itching or pain. So, of course it different people will have different
of
experiences
course.
with, where I can't wear anything in my scalp for more than 2 weeks because my scalp itches. So I
Yeah.
just can't really wear protective styles without them coming out really quickly.
Yep.
But some people are able to deal with going without washing, and their hair is thriving. So it really just depends. For protective styles like sew-ins, if it's not done too tightly and you have a way that you can actually clean the scalp, and
Hmm.
there are some brands that offer like apple cider vinegar based like cleansers and
Hmm.
things like that. If you can access the scalp in that way and your hair does well, I think that's fine. But if you have scalp and hair issues, you really should steer towards more frequent care of the scalp.
Yeah. And that's helpful, right? Because it goes back to really knowing and monitoring and understanding your hair and
Hmm.
what that looks like and understanding. I know I'd be observing my family's hair. I'm like, my grandma's hair is doing this. Is that going to happen to me?
Hmm.
Like I observe my mom, just being mindful because I think we can tend to disassociate our hair as like something to be considerate of sometimes. But like really
Hmm.
that's something we ask about family history for all these other things. Like you mentioned baldness, and I know I referenced the like young lady that said she had hereditary alopecia, or at least that's the clip I caught from social media because I am very behind on the Netflix. But like monitoring things like that, that's something that piqued my interest personally because I heard of traction alopecia a lot, but I've never really thought about like alopecia being in the hereditary space. Can you talk more about that? I know that's a common one that a lot of people experience or consider.
I kind of feel like the majority of the alopecia that I see is hereditary in some way.
Mm,
So
okay.
androgenic or female pattern alopecia, which is the same as like male pattern, when men lose their hair at the top or their hairline starts receding, that's male pattern. But women can experience female pattern hair loss as well, and probably about half of us will experience it by the time you're 70. So that's really more of it's not really an actual loss of the hair, it's a thinning of the follicle in a sense. So if the follicle
Mm,
is the hair is the thickness of your
got it.
thumb to start, then it gradually shrinks down to a spaghetti noodle. So you just get gradual thinning of the hair. And so
Yeah.
there's things that you can use to correct it, but that's genetic. It can come from both sides of the family. I don't know. It used to be where people would think it only came from the dad side of the family, but it can be on either side. That's genetic. And then one of the most common alopecias that I see in Black women is CCCA, which stands for Central Centrifugal Cicatricial Alopecia. Essentially, it just
Mm,
means there's hair loss that starts in the center of the scalp and it kind of just spreads outward like a centrifuge. And sometimes it can be patchy, like it doesn't always start in the center. Sometimes it's kind of more spread out, especially if you had a history of braids and locks. And so that's genetic, but it's also due to hair care practices which trigger or make your hair follicle more susceptible to damage. So there's a defect in a gene that's involved in like protein synthesis, and it kind of impacts how susceptible that follicle is to like trauma. And so if you're doing a lot of things that traumatize the hair and you already have a defect in that gene, then you're going to experience hair loss more than someone who doesn't have a lot of hair practices that involve tension. Like I have a few aunts
yeah.
and cousins that have CCCA. I don't think I have CCCA, but I know I have a predisposition. But I didn't wear a lot of braids. I didn't wear a lot of things that pulled. And so, of course, how you treat the scalp will determine whether or not you actually experience hair loss. So you can have a
Mm,
genetic susceptibility, but it doesn't mean that you would develop that disease. It's kind of like high blood pressure and
yeah.
diabetes. You can have the susceptibility, but your diet and your lifestyle kind of determine whether or not you actually have that disease. And some people will do very little to their scalp and they have such a strong genetic background for it, they still develop it, even when they say, I've been wearing my hair just like how it grows out of my scalp my entire life. So there's different variables that can contribute, but the genetics is there. And that has to be there really for you to develop that. And so that can permanently destroy the hair if you have enough tension or inflammation around the
mm,
hair follicle over time. And then your autoimmune alopecias, that's genetic because autoimmune disease can be genetic. So your alopecia areata, where you kind of get perfectly smooth, random patches that kind of come and go.
yeah.
And so, generally speaking, if you have autoimmune disease, there's somebody else in the family that probably has it. So, may not be alopecia areata, but somebody else may have like thyroid disease or lupus or rheumatoid arthritis. And so we
Mm.
always ask about those things. Psoriasis is usually more of a scalp thing, but it can cause like a psoriatic alopecia because it inflames the scalp so much that the hair can't grow. So there's sometimes patients I will see that have
Yeah.
psoriasis and hair loss. I take a biopsy because I'm trying to rule out some other type of alopecia, and it just comes back as psoriatic alopecia, meaning that the scalp is just so inflamed that it's making the hair follicle give up.
Yeah. Wow. Wow, right? Because I think getting down to the different types, right? Like we just hear alopecia as like a blanket term. And so I'm really just digesting. I want to go back. You said protein, like a defect in protein synthesis. And so my
Mhm.
brain's like, ooh, science words. Let's break it down a little bit. But essentially, like our hair strands are made of protein. So it's like a defect in how our like protein builds up to create our hair strands. Is that like a safe understanding?
It's the Patty 3 gene, I think that's what it's called. But it's involved in, the functioning of the follicle. And so
Mhm.
if there's a defect in that gene, that follicle it doesn't have the same normal integrity or strength of a follicle that doesn't have a defect. So that puts the hair follicle at just an increased risk of damage
Got
from
it.
just grooming. So if you have
Mm,
curly hair, even when I pull my brush through my curls, there's tension that's placed on
right.
it. So if you have that gene defect and you're doing things that pull on the follicle in any way,
Yeah.
you can increase the risk of hair loss. But usually it's more like hairstyles. But if you have really curly or tightly curled hair, grooming itself can be traumatic.
Right, because you're really kind of
Yeah.
trying to work through your coils or your
Mhm,
kinks or your curls or your strands or
mhm,
whatever pattern you have, whatever texture it looks like. And so that
mhm,
snapback, like the elasticity that you're taking
mhm,
it through of that tension
mhm.
process. So it sounds like there's some things, right? Like, especially if you already have autoimmune diseases in your family that you want to be more mindful for. And then there are some cases in which you could potentially be predisposed and like doing these high tension styles can make it worse or cause the alopecia or the is this a case where that would kind of be like a traction alopecia, like the pulling and the causing what caused that to appear?
Yes, many of my patients who have traction often will have a concomitant CCCA, so they already have a tendency towards scarring alopecia. Sometimes we can just see traction alopecia just turn into scarring. So if you inflame the hair follicle for a long enough time, it can turn into scarring. So scarring alopecia. So there are
Mhm.
different types of scarring alopecias. So CCCA is just one type, but
Yeah.
traction can turn into scarring if the hair follicle is inflamed enough. Discoid lupus is a type of scarring alopecia. There's one called lichen planopilaris, which is very inflammatory. It's a type of scarring alopecia. So I see all of those. And usually I like to take a biopsy when patients come in with hair loss concerns because a lot of my patients have 2 and 3 and 4 different diagnoses. And so if you kind of can identify what's going on, you can really be more targeted in the treatment. But I think the biggest thing is if you're experiencing persistent or chronic itching or pain, you need to see a dermatologist because
Okay.
you can temporarily get relief from shampoos and different things that have ingredients that offer relief for your symptoms. But like, why is that happening? Why do you need to do that? You shouldn't need to do that. And so I always say just seek a professional opinion so that the scalp remains healthy so that you can actually keep your hair. Because I often will see a lot of patients who come in too late where
Mm.
they tell me things have been going on for 10 years
Oh
or it's been
wow.
going on for 5 years, which is a long time to experience symptoms and not actually go see someone. And then a lot of times it's too late to get the hair back.
Yeah. And so you talk about the language of being inflamed, right? And so to clarify, like the inflammation is like the manifestation of the scalp itchiness, the irritation, the flakiness. Those are the signals that we would want to look out for to identify the inflammation.
So yes, inflammation, a symptom or sign of inflammation will be itching, tenderness, or pain. But inflammation is really just our body's way of telling us something's wrong. So if
Mhm.
something's broken, you might have pain in the area. If something's not functioning or not in a healthy environment, you might feel like it's swollen or itchy. So there are things that can happen, but you won't necessarily know it unless you experience the symptom of it. So our body kind of oscillates through different states of inflammation, some which we recognize and some we don't. But when you can perceive it, I think that's enough to try to
Yeah.
figure out why it's happening.
Yeah. And you commented earlier on about like diagnosing to identify the right type of treatment. So I'm going to circle back to a question on treatments, but I wanted to kind of ask about, are there any like stresses, lifestyle factors, things outside of necessarily like scalp manifestations that could potentially trigger a scalp issue? Like if we're experiencing like significant stress, does that show up in our scalp, or are there other kind of factors outside of maybe a predisposition that could lend to some of the cases that you potentially see?
I think stress can, well, I know stress can make everything worse. So, stress can
Yeah.
definitely trigger alopecia. So, like stress induced shedding.
Mm,
Dandruff can actually, any sort of skin condition can be triggered by stress. So, your seborrheic dermatitis can be triggered by stress. Your psoriasis can be triggered by stress. Your lupus can be triggered by stress. So, stress, due to the way that it raises cortisol, and cortisol will raise inflammation in the body. So, stress always can result in worsening of a skin disease, whether it be hair loss, acne, or some scalp conditions.
yeah. Yeah. And to clarify for the people that might not have any type of science base, what is the function of cortisol in the body? Because you said an increase in cortisol can raise our stress levels, but what is the actual purpose of it?
Cortisol is like a fight or flight hormone. So
Mm,
when we were like hunters and gatherers, like, when we wake up in the morning,
ah,
like we get a cortisol burst just to
yeah.
kind of wake us up and get us going. So, I mean, it has the function, to really just help you survive. And if you need to hunt or run after something or just be
Yeah.
productive, you need your cortisol just for everyday functioning. But you don't, there's a such thing as too much of it. But it's like the stress hormone, and you definitely don't need cortisol always flooding your body. So it
Yeah.
just can promote inflammation in the body if it's too much. We need it to function, and there's a good reason to have cortisol functioning, but you definitely don't want an overproduction of cortisol.
Absolutely. And I think it's just important for people to hear and know so they don't hear it. And like the next time they hear the word cortisol, they're like, oh no, like, afraid, because everything in our body has a purpose. But right, like the over functioning, like the
Mhm.
overproduction of those things is something we want to be
Mhm.
mindful of. And so knowing that like stress can be an exacerbator, that when you're seeing like these different patients, what treatment options are available, right? Like, is there treatment for alopecia, or does it depend on the case if it's hereditary? And I know we kind of talked about seborrheic dermatitis and cleansing, and even for psoriasis and some of these like commonplace things that we're experiencing. Like, what does that process look like for treatment?
Is all of the scalp and hair conditions I've mentioned are treatable. Of course, there's stress. I always kind of touch on, trying to reduce stress.
Absolutely.
It seems like everybody's stressed, and we all have some form of
Yeah.
stress.
Yeah.
But I'll touch on other ways they can like help to relieve their stress. But we can treat, like, we often will use scalp injections for inflammatory alopecias. We will use,
Mm,
for more hormonal alopecias, we'll use hormonal therapies that either reduce or affect the testosterone, your sensitivity to testosterone, which is usually what happens in female and male pattern baldness, is that your testosterone is just shrinking the hair. So if we can make you a little bit less sensitive to it, it allows the hair to thicken.
mm,
For alopecia areata, we often will use injections and steroid injections or anti-inflammatory medications.
mm,
We often use rosemary oil, which is anti-inflammatory.
mm,
We have one here in my office that has cedar, sage, lavender, and peppermint. So we're using kind of the
mm,
natural anti-inflammatory ingredients to reduce inflammation and make the hair grow. We use minoxidil, which is the branded name. It would be like a Rogaine,
mm.
and that helps to increase blood flow to the hair follicle. So we can treat with a lot of different modalities. Most of our hair loss patients have multiple things that we use. And then
Yeah.
cosmetically, there's platelet rich plasma, as well as exosome treatments, which help to stimulate the stem cells around the hair
Mm,
follicles and kind of shift the hair into a growth phase. So we kind of,
yeah.
generally speaking, the hair is either 80% of the time it's growing, and then the other 20% is like
Yeah.
resting or shedding. So PRP and
Mm,
exosomes shift the hair cycle to where it doesn't get a chance to rest or shed. And so the
yeah.
hair is able to continuously grow, and so it gets thicker and longer. But we're able to it also creates a healing, a regenerative environment. So
Yeah.
it helps to recover the hair follicle too if it's struggling, or what we call miniaturized. So it looks like it's gone, but it's just so shrunken down that we can't see
Yeah.
it. So when we combine medical treatments with cosmetic treatments that make the hair grow, we can help to recover some of the hair and thicken the hair that our patients have.
Yeah. I one just love the range of options, right? I think for the oil that I have, like there are nourishing hair oil with your hair made simple. We formulate it and there's rosemary oil included in that as well, like for those anti-inflammatory properties. Because like I said, I had a lot of scalp sensitivities, but I love that there's like the natural options, but then also like exosome treatments, right? Like all of these other things that you can do to like help with repair. I'm just like, we love science. We love the variety of options, right? And I think even as I was just looking through your website, because I was like, well, let's see what like types of derm treatments are offering and like reading about all the different things. I think it gives like hope to people, right? Especially sometimes when you don't know about these things, which is why I think this conversation is so important. It can feel like very frustrating and maybe even hopeless to experience hair loss. And you see the patient, so I'm sure you know the emotions that they're navigating behind that, the variety of options, right, that are available to them in terms of treatment, I think is exciting to know that those advancements have been made.
Often we'll have clients or patients come in and they've seen someone before me, or they've tried to just kind of work through things with their hairstylist, and they just didn't know that, there was an option. But most
Exactly.
of the diseases that we see, even if we can't always get the hair back, in some cases we can keep what you have. So it's like never like
Yeah.
unless you're like completely bald, it's not too late.
Yeah. So the sooner you ask for
Bald
help.
doesn't mean that you can't get it back either. So I'll take that back, because we can get hair back in completely bald patients too. So it just depends on the type of alopecia.
So the sooner you ask for help, the better. For those listening, if you have questions, go ask them to a derm. The sooner, the better. I wanted to ask, and so this is actually like one of my friends from church who is older, and she has experienced some like hair loss things, and she was advised to get DHT blockers. And so I would love if you could talk a little bit about that, and if it's one of those treatments you already kind of mentioned, like elaborating on it more, but like how that necessarily works in helping with hair loss and recovery as well.
DHT blockers really help more so if the hair loss is hormone related. We talked
Mm.
about testosterone shrinking the hair follicles. So in the body, the inactive testosterone is converted to testosterone. And so you can block that conversion. That's what the DHT blocker would do. You can keep active testosterone from blocking, from
Mhm.
shrinking your hair. So essentially, if it's a hormonal alopecia, that's helpful. But if it's inflammatory, it's not very helpful. But because so many people, again, I talked about 50% of people will likely get it at some point, you still can sometimes see benefit from it, because most people will have, like when I do a biopsy of a person who has true inflammatory or scarring alopecia, they often will have female pattern or male pattern as well. So we incidentally find it. So if you take something like that, you might notice some improvement, but then you kind of reach a plateau, because that's really not what's going on. That's just incidentally there.
Yeah.
So it would help only if it's a hormonal based alopecia. If it's due to lupus or a CCCA or lichen planopilaris, that's not going to help your scalp
Yeah.
or
Yeah.
hair.
No, I appreciate you for clarifying that because again, so many conversations, so many different types of treatment. And I know that you talked about like as we get older. And so just to clarify this, like is hormonal alopecia something that we could experience just with age and the natural changing of our hormones too? Or does that fall into that hereditary category?
Yeah, it's just aging. So as you
Mhm.
age, there's a subset of follicles, usually kind of in the center of your scalp, that are more sensitive to testosterone. You become a little bit more sensitive to that testosterone as you age, which
Mhm.
is why we don't see it in kids usually, but I've seen it in as young as a 17-year-old
Oh, wow.
patient. So just as you get older, those follicles are more susceptible to that shrinkage. So the testosterone, if you can block the testosterone or reduce it, you can keep the hair from shrinking.
Yeah. I'm sitting here trying to imagine what my like 50, 60-year-old self is. And I'm like, Shannon, we got to tighten up now. We got
Yeah,
to
I
get it
mean,
together now.
it's like rosemary oil. I mean, rosemary oil once a day is fine. If you really are already experiencing hair loss, I like twice a day, because if you use it twice a day, it's like the equivalent of using a 5% Rogaine.
Oh, wow.
If you're experiencing hair loss, it's good. I usually, most of my hair loss patients will do minoxidil and rosemary, because they want to get their hair back.
Yeah.
But
Yeah.
if you're concerned about it, if you like to incorporate rosemary, that's
Yeah.
a good way to keep the follicles stimulated.
The nourishing oil that I blend, it does also have like rosemary oil and peppermint oil in it. Those are the two ones that I use because
Mhm.
of that. And so I often operate from a like preventative stance. And so thinking about those folks that are listening, right? What are some of we kind of touched on it a little bit earlier, but like the healthy scalp habits that we can be curating right now if we want to take that preventative stance and approach? The rosemary
Mhm.
oil kind of being one that we could add in, but if any others.
I mean, on a most basic level, I just think caring for the scalp in a regular way. So, like, if you're the type of person your hair can tolerate twice a week, like I wash my scalp twice a week because I can tolerate it. But I
Mhm.
usually recommend my patients wash your scalp at least once a week. And I always say the longest I would go, just based on my professional opinion, is 2 weeks because you really want to make sure you're removing oil, dirt, sweat, pollutants, and irritants. And that just keeps your scalp and hair at its healthiest.
Two.
Definitely moisturizing the hair. Our hair, there's the thought that we African Americans or Black women don't produce as much oil. We produce oil, but the issue is with the coil, oils don't always make it to
Make it
the end of
down.
the hairs. We often will have to add more moisture and more oils to our hair to kind of keep it healthy and strong. So I like leave-in conditioners and moisturizing oils. You don't necessarily have to moisturize the scalp because that is it produces its own oils. And sometimes if you have seborrheic dermatitis, it can kind of worsen it because that yeast really likes to overgrow when the scalp is really oily. And so taking good care of the hair,
Mhm.
but making sure the scalp stays clean, minimizing tension and traction. And so, like, if you get a set of braids every time you go on vacation, that's not concerning. But if you're always in braids or things that pull on the edges, pull on your scalp, you're really setting yourself up for having some form of alopecia,
Yeah.
especially if you have a genetic predisposition. But doing
Mhm.
something every now and then is not a problem. In fact, rotating your hairstyles is always a good thing because it just
Recommended.
allows your follicles to get a little bit of rest. But I mean, I talk about protective styles, and then I go in the same vein. I say grooming your hair is traumatic. So there's kind of an in between where like it makes good sense to not overdo the managing of your hair because you'll get a
Yeah.
lot more breakage and shedding depending on your hair type. So like twist outs, I like twist out styles that you can kind of twist up, you pull them out, you wear them for a week or
Mhm.
so. I feel like those are really good because they're low tension.
Yep.
You can kind of minimize the amount of times you're like pulling and combing, pulling through your hair. So, of course, you just got to find the sweet spot for your hair
Yeah.
type. But definitely, if you have persistent itching or tenderness, you should talk to a dermatologist to just make sure that there's nothing going on.
Absolutely. And then I wanted to follow up because we talked about seborrheic dermatitis and some oils really like exacerbating the issue. Are there any oils that are maybe safe or like lightweight and better if they are in a product or just an oil itself that somebody could use while they're navigating that if it's present like in some of their products or ingredients?
Yeah, I mean, I like the like tea trees or rosemary oils. Olive oil, like I sometimes will recommend like olive oil for like babies when they have cradle
Hmm.
cap, which is just seborrheic dermatitis. I don't think the oil itself is bad, and there are people who can use oil on their
Hmm.
scalp with no problem. If you don't have seborrheic dermatitis, you can probably oil. Like I know people who can put Vaseline on
Hmm.
their face and they're just fine. But if
Wow.
I do that, I'll get acne. So
That is
it
bold.
really just depends on your skin type.
Yeah.
I wouldn't say that, I think most of the natural oils are okay to use. I like coconut
Yeah.
oil. I love argan oil on my hair. But if you have seborrheic dermatitis, I think the focus should be putting the oil on your hair and not the scalp.
Got it. Thank you for clarifying that because I
Mhm.
know I've read a bunch of articles like if you have seborrheic dermatitis, avoid jojoba and argan and everything under the sun. And it's like, well, then what is
Yeah,
left? Because this
it's
is
so
also my
hard.
product. So, like, how do I combat that? But it's more so about like minimizing its contact with your scalp and making sure that it lands on your hair
Yeah,
where it needs to be and
yeah.
that your scalp is
This
getting
is
the
going to
cleansing
harm
it needs.
you. It's just more likely to make that yeast overgrow. So you
Mhm.
want to minimize the triggering of that yeast, so to speak.
Yeah, absolutely. Okay. Well, then winding down today's episode, because I feel like this has been so great and just really informative, right? In terms of what are we navigating, what are we trying to combat, and how we can be mindful of it. But for those who are navigating maybe alopecia, psoriasis, work dermatitis, any of those things, what would be one final piece of advice? I know we've kind of shared like some tips and tricks, but one final piece of advice that you would share with them as they are, really learning how to better care for their scalp and navigating these experiences.
It is not normal for your scalp to be persistently itchy or tender or painful. I would always get a second opinion or professional opinion to see what the root cause is, because you can really, most of the things that cause these symptoms can be treated. Some of them can be treated with natural things, but I think
Yeah.
just knowing what's going on sets you up for better success in just managing your scalp and your
Yeah.
hair.
Information is powerful and information is key. So let's not be afraid of it. And I say that because that's what I'm taking away, because I'm somebody who'll be like, this will go away. And it's like, it's actually not going to go away, and you avoiding it won't make it like less scary. So let's just confront it, because it's better to know and then treat than to not know and exacerbate.
I agree.
Yes. Well, then my final question for you, after you've shared so much wealth of knowledge, is if you could say one affirmation to your hair right now, what would it be?
I would say I honor and care for my hair with patience and pride.
Wait, I love that. Big key on the patience, right? Because I think sometimes we want to see the results overnight. We want one product, we want one oil, we want one thing to work, and everything like takes time and diligence and care. So I love that.
Mhm.
And I just co-sign that, plus double tap. Okay, well, that is our episode for today. So for those who are listening, I hope that you were able to hear Dr. Cornelius's advice and really just take away and reflect on your own scalp state, reflect on your own hair journey, and assess where you are. Do you need to see a derm? Do you need to get something checked out? Or do you feel like you're doing great? Do you want to add rosemary to your routine? But really reflect on the knowledge and share this episode with somebody who is experiencing one of these things or has some scalp concerns to help them be better informed as well. So that's all that we have for today's episode. Thank you, Dr. Cornelius, for joining us.
Thank
And
you.
until next time, for those that are listening, for those that are watching, remember that all hair is good hair and your hair is good hair.